Hello to all my friends and to my colleagues, healthcare professionals everywhere. This is Professor Dr. Tarek Ali. Today I will talk to you by the way, I'm talking from Istanbul, from Turkey, and this is a live presentation to all my followers and my students and my colleagues and my friends who are following me regarding my presentations in clinical medicine and in clinical practice topics. Today I will talk quickly about, or in short, about the management of chronic diseases or chronic disease management in clinical medicine. What are the principles of chronic disease management? We all know that in medical practice and in clinical life, our cases are either acute or chronic. Acute, this is what we call acute medical conditions, including the emergency cases and the emergency medicine presentations, like acute pulmonary edema, acute heart failure, hypertensive crisis, hypertensive urgency, acute liver failure, acute renal failure, cerebral hemorrhage, acute metabolic decompensations like diabetic ketoacidosis, like thyrotoxic storm, etc., etc. These are just examples of acute medical conditions or emergency medical conditions. And these emergency medical conditions, we usually manage them by what we call the aggressive approach. We have to be aggressive and radical and quick in the management, because these acute medical conditions, they might be life-threatening and cause not only morbidity but mortality. That's why we have to be aggressive, or to take what we call the aggressive approach, and to be aggressive and fast in management, and at the same time wise and radical in approach. The chronic diseases, on the other hand, they are rather chronic. They are, in most of the cases, they have different clinical course or a different biological behavior. Many of them are progressive diseases, and others are heterogeneous with remissions and exacerbations, or with remissions and relapses. So the chronic diseases might take either the progressive form or the progressive course, or might take the what we call the intermittent course with, as I mentioned, the remissions, the disease is quiet, and then exacerbations or relapses, the disease exacerbates or gets into crisis or gets into acute problem, what we call acute on chronic, or exacerbations on an underlying medical disease, intermittent course. Or they may be progressive diseases like, for example, diabetes, like hypertension, like COPD, like bronchial asthma. Bronchial asthma, of course, can be intermittent or can be progressive. There are many presentations of bronchial asthma. Also, COPD, obesity, diabetes, as I mentioned, hypertension, many of the metabolic endocrine diseases like the thyroid disorders, the thyrotoxicosis, and the hypothyroidism, etc. And of course, neurological diseases like Parkinsonism, like multiple sclerosis, like many of the neurodegenerative diseases and demyelinating diseases. These are, and the migraine, headaches, and the epilepsy. These are chronic neurological conditions. All chronic diseases, as I mentioned, they might be either progressive, they take a progressive course, and they are also rather heterogeneous. They are not homogeneous in presentation, and they have a natural history. They pass into stages from the beginning till the end, and they might be surrounded by, or they might have also what we call complications, or end organ damage, or systemic complications. The management of this management of chronic disease depends on the stage of the disease itself, whether it is in the early stage or in the later stage. And the If we meet the case in the early stage, our main aim or objective is to delay the progression of the disease, delay the progression of the disease. If we cannot prevent the progression of the disease, at least to delay its progression and prevent complications of the disease and or what we call end organ damage. Like, for example, in hypertension, the renal complications of hypertension, the cardiac complications of hypertension, the neurological complications of hypertension. These are called the end organ damage in patients with systemic arterial hypertension. In patients with diabetes, to prevent, of course, the microangiopathy and the macroangiopathic complications, the microangiopathy or the microvascular complications like the retinopathy, like the neuropathy, like the nephropathy. And I mentioned also the macroangiopathy affecting the macro vessels or the large vessels, especially the vessels of the heart, the coronary artery disease, the vessels of the brain, the cerebrovascular circulation, and the vessels of the periphery, that is peripheral arterial disease. So this is the aim, to prevent the macro and microvascular complications of diabetes as a chronic medical disease. In obesity, as the most common chronic medical disease, and especially that it is also associated with other endocrine and metabolic and systemic and other organ and other system complications, multiple complications of obesity. We have to prevent the complications of obesity. We have to treat the obesity. We have to put them under control. In general, the chronic diseases, they are in most of the cases controllable and not treatable. There is a difference between treatable disease and the controllable disease. For example, diabetes is controllable. We can control the hyperglycemia, being the denominator of the diabetic syndrome, the hyperglycemia. So the hyperglycemia is put under control, not under treatment, because it does not, if the symptoms and the disease disappears, we call this disease, we call it treatable disease. There is cure of the disease. It is treatable or curable disease. But diabetes and hypertension and COPD and these things, they are not treatable or curable, they are controllable diseases. We just control the symptoms and try to control the pathobiology of the disease, and number three, to prevent the complications of the disease and improve the functions or the functional status of the patient, and at the same time provide him or her with better quality of life, and in order to minimize the hospital admissions and the hospital visits in such chronic diseases. So number one in the management of chronic disease is to control the symptoms of the disease, and more important than to control the symptoms is to control the underlying pathophysiology of the disease. That is, the treatment should be a pathobiology-oriented treatment or pathobiology-oriented therapeutic decision, rather than being symptom-oriented therapeutic decision or therapeutic approach. Again, I repeat again, the therapeutic approach which the clinician should decide must be pathobiology oriented rather than symptom oriented therapy. To treat the disease or to control the disease from its roots, we have to control and manage its pathobiology, not just the symptoms, because the pathophysiology, as I mentioned before in one of my clinical presentations, it is the core problem of the disease, and it is the origin of the disease, and it is the root of the disease. So we control the root or the origin of the disease, not the arms of the disease. مش أزرع المرض اللي هي الأول السطح. We control the depth of the disease, عمق المرض. We don't control just the surface of the disease, or to control the disease superficially, that is the symptoms of the disease. No, we only try to control, to put the symptoms. If we can't control the pathobiology, if we can't understand the pathobiology, if we can't treat the pathobiology here, we have to at least to control the symptoms or treat the symptoms of the disease. But number one, for radical treatment and for more rational treatment and for more proper treatment is to treat the pathobiology of the disease. And number two, after the pathobiology, is to treat the symptoms. If we don't understand the pathobiology of the disease of the patient, so at least to treat the symptoms. This is what we call the symptomatic treatment. But the symptomatic treatment is not the basic in medical practice. مش هي الأساس في العلاج في الطب، هي علاج الأعراض. لا، الأساس هو علاج أصل المرض اللي هو the origin of the disease, the root of the disease, جذر المرض، منبع المرض, which is the pathobiology. Again, I repeat, the pathobiology. If the doctor can't control the pathobiology, here the treatment will be more effective and more successful and more wise. So pathobiology oriented therapy, number one, and number two, symptom oriented therapy. Of course, if the pathobiology is treated, the symptoms will disappear. That's why it is the best. But if we don't know the pathobiology, here at least treat the symptoms or put the symptom under control. For example, pain is a very common clinical symptom. If you don't know the cause of pain, at least control the pain by giving painkillers, for example, like non-steroidal anti-inflammatory drugs, like simple analgesics, like other more stronger analgesics. So this is the symptomatic treatment. For example, if there is bleeding, you have to stop the bleeding, control the bleeding, because it is a symptom. So the control of the symptoms comes number two as the aim after control of the pathobiology of the disease or targeting the pathobiology of the disease. انك تهدف وتضرب الباثوبيولوجي مش السيمتومز. الباثوبيولوجي if successfully targeted and put under control and arrested, the symptoms will disappear, of course. But the opposite is not true. That is, we can control the symptoms, but you have left the pathobiology. So be aware that the most important in therapy, if the therapy is targeting the pathobiology, and this is what we call pathobiology-based or pathobiology-oriented therapeutic approach. This is the best in therapy as an important part and is the ultimate part of clinical management. نحن عارفين clinical management عبارة عن diagnosis, that is diagnostic process, العملية التشخيصية. number two, the therapeutic process أو العملية العلاجية. هم دول أذرع والذراعين بتوع المانجمنت، الإدارة. تشخص وتعالج، والأساس هو إنك تشخص صح، لأنك لو ما شخصتش صح مش هتعالج صح. بالتالي لو المرض أنت مش مشخصه مظبوط، العلاج يبقى مش هيبقى effective, because this is not the proper diagnosis. Well, part of the diagnostic process is to know the pathobiology of the disease. What is the cause? What is the pathobiology or the pathophysiology of the disease? And what is the biological course of the disease and the natural history of the disease? And you are at which stage of the disease in that particular case, in that particular patient. Because not all the patients with hypertension, they have the same pathobiology. Pathobiology of hypertension is multiple. It might be RAS dependent, that is renin-angiotensin system related. It might be due to what we call plasma volume related. It might be due to increased sympathetic charge, that is autonomic hyperactivity related. These are very important basic mechanisms in the pathogenesis of hypertension. Is it related to the RAS system? The RAS system, that is the renin-aldosterone angiotensin system, or at any of its parts of this axis, of this physiological axis, the RAS, RAAS, renin angiotensin aldosterone system. So here we can be successfully, or we can successfully treat the patient with, for example, ARBs, that's angiotensin receptor blockers, or with ACE inhibitors, that is angiotensin converting enzyme inhibitors. combinations or combination therapy, like aliskiren, for example. We used it before. So this is if there is. If it is sympathetic overactivity, the best is to treat the patient with hypertension with sympatholytic medications, central sympatholytic or peripheral sympatholytic medications, like the beta blockers, for example, whether cardioselective or non-selective. The old non-selective, but now we prefer the cardioselective beta blockers, for example. These are medicines which act on the sympathetic nervous system, or the sympathetic autonomic nervous system. Or if it is hypertension related to the plasma volume, so we can treat well with diuretics, for example, by all of its categories. The best is the loop diuretics or the thiazide diuretics or other types of diuretics. So the pathobiology should be understood. That's why I told you most important is to understand the pathobiology of the disease and to control the pathobiology, and so to control the symptoms of the disease. So control of the symptoms is very important. To improve the quality of life is very important. And then comes after that the third more important and the most important, to prevent the complications and to delay the course of the disease and prevent its complications. And these are related to each other. To delay the course of the disease, if it is a progressive disease, to prevent the disease from reaching to the advanced stage. This is controlling progress. And number two is to control the complications, or to prevent the complications. As I mentioned, in diabetes, the microvascular complications, the retinopathy, the nephropathy, and the neuropathy, and the macroangiopathy, the cerebrovascular, the cardiovascular, and the peripheral arterial disease. These are all important to be put under control. Prevent the complications is one of the most important aims of chronic disease management. انك تسيطر على الاعراض والباثوبيولوجي. This is number one. And number two, to prevent complications. And this is the aim of regular checkups. يعني انك تزور العيان دايما. The very important تزور الطبيب دايما. As if that's to have regular clinic visits. That is to visit the doctor at regular times. What we call regular follow-ups. انك تتابع بانتظام. Every month, every 3 months, or sometimes even if the disease is not controlled, every 2 weeks, every 1 week, or more frequently, maybe every few days, if the disease is not controlled. This depends on the case, and the doctor will, or the clinician will decide the future follow-up and the future check-up and follow-up visits for every individual case. This is part of what we call the personalized therapy or the individualized therapy, which is related to every individual patient, and there is no one rule which can be applied to all patients in this regard. So this is very important to control in disease management. In chronic disease management, the regular follow-up is very important. Regular checks is very important. Whether a regular checkup with the doctor in the doctor clinic, or regular checkup in the hospitals, in regular hospital visits every 1 month or every 2 months or every 3 months, depending on the severity and the duration of the condition and the age of the patient and the presence or absence of complications and the presence or absence of what we call comorbid conditions. That if the patient is diabetic, does he have hypertension, co-hypertension, that is hypertension or not, or dyslipidemia, for example, because you know diabetes, hypertension, and dyslipidemia or lipid disorder, they are triangle of cardiovascular metabolic problem in most of the cases, and they are related to each other, the hypertension, diabetes, and the dyslipidemia. So we have to, that's why we have to ask the patient for regular checkups for these conditions. That is the aim of the regular clinic visits, or regular clinic follow-up, or regular hospital follow-ups. This is very important to be considered, and this is part of the chronic disease management in order to improve quality of life, treat symptoms and improve quality of life. يعني بتعالج الاعراض، بتعالج الباثوبيولوجي اللي قلت لك اهم من الاعراض اللي هو اساس المرض اللي هو منبع المرض، الباثوبيولوجي او الباثوفيسيولوجي of the disease, or what we call the etiopathogenesis and the etiopathophysiciology of the disease. وبالتالي بتسيطر على الاعراض. نمره 2 انك بتسيطر تحت improve الكواليتي اوف لايف، بتحسن حياه المريض، نوعيه حياه المريض في at home at work with his family etc. انك بتخلي الكواليتي اوف لايف is good, and this is one of the purposes of medicine, of clinical medicine in general. تحسين نوعيه حياه الناس بالسيطره على الاعراض، وان هم يقدروا they can manage to participate in regular daily life activities, evening and morning, at work, at home, etc. And at the same time to prevent the complications of the disease وتمنع مضاعفات المرض. And here comes how can we prevent the complications and to control symptoms and to prevent the complications of the disease in chronic disease management is by being adherent to medications and adherent to medical advice regarding medications, the doses of medications, the how to take the medications, the frequency of the medications, and the in case of injections, the if the patient is taking injectable medications or medicines, we have to teach him or her how to use and to inject the medication. For example, in patients with diabetes and in patients with asthma who are taking biologic therapy, which require to be injected subcutaneously. Also in diabetes, the same insulin and the insulin analogs and the patients taking the GLP-1 receptor antagonist medications and other types of medications which need to be injected. We have to teach the patients how to inject them properly in order to be effective and to get its clinical efficacy. This is very important. So here, adherence to medications and to teach the patients how to take the medicine, whether oral or injectable or others, you have to teach them, and the patient has to be adherent to the medicine. And to be adherent to the medicine, the patient should understand what we call the convenience of medication administration, and it should be tolerable to the patient, and the patient should accept it. These are factors related to adherence to medicines. Adherence to medicines, the convenience and the tolerability of the medication to the patient regarding the age of the patient, a child or middle age or geriatric case, that is elderly old case. So adherence to the medicine is the most important. And another important part in the management is lifestyle medication, the lifestyle modification. That is, the patient has to understand what is the healthy food. So healthy eating style is very important. Healthy eating style is very important. I repeat it again. Healthy eating style يعني النظام الغذائي الصحي is the secret of success in management of chronic diseases. How to eat healthy, and this is called the healthy lifestyle. So healthy food is the secret. Healthy nutrition is the secret. That's why we might involve clinical nutritionist or clinical medical nutrition specialist in the team, especially in patients who are difficult to control regarding their food and drinks, that is their nutrition. Nutrition plays an important part in the treatment of any disease. You are what you eat, as I mentioned before. So healthy eating style. Also, regular exercise is very important in management of many chronic medical diseases. The patient has to do some sort of exercise, mental exercise, physical exercise. So regular exercise is important. The patient has to have good sleep. Good sleep is very important. It's part of the management of chronic diseases. The patients to sleep well, quantity and quality. النوم مهم جدا في المانجمنت of chronic diseases. نوعية النوم وكيفية النوم وعدد ساعات النوم وتختلف من differs from case to case, but the it's all under one heading, which is a good sleep, good healthy sleep, healthy sleep, healthy sleep. زي ما قلت healthy food, healthy food، هقول healthy sleep، تنام كويس، عدد ساعات النوم وكيفية النوم وعدد ساعاته، وده يختلف من حالة لحالة ومن سن إلى سن، كل حالة ليها تفاصيلها. أنا بتكلم جنرال دلوقتي. النوم مهم، الأكل مهم، الريجولار اكسرسايز والرياضة مهمة جدا، نظام الأكل مهم جدا. Get away from stress، البعد عن الستريس. Get away from stress is part of the healthy lifestyle modifications for treatment of chronic disease. Get away from stress, because stress can deteriorate diabetes, hyperglycemia. Stress can make hypertension worse and difficult to treat. So stress can also induce problems in bronchial asthma patients and in COPD patients. And in, of course, obesity cases, especially that obese people, they are mostly anxious and depressed, that is having an anxiety and depression and stress. Control your stress is part of control of chronic diseases. Control your stress, stress control, stress relief. This is part of the healthy lifestyle in chronic disease management. فهنا السيطرة على الستريس، السيطرة على النوم الصحي، الأكل الصحي، الرياضة، الاستمرار وبصورة منتظمة. And also get away from bad habits like smoking, avoid smoking, and avoid alcohol. Avoid smoking and avoid alcohol. This is also part of the healthy lifestyle. By this, I have finished in general the management of chronic diseases. And again, at the end, I have to say, take control, take control, take control, and the patient should have active role in the management of chronic medical diseases. It's not only the role of the doctor, the patient should have should participate actively in the management, and this is what we call the active participation of the patient in chronic disease management. The patient should understand the pathobiology, should understand how to adhere to medications, should understand when and how to modify the doses of medications under certain conditions, in certain places, in certain times. دي بنسميها الاكتف participation of the patient in chronic disease management. وده لوحده ايتم محتاج education، تعليم للمريض عشان يعرف ازاي طبيعة مرضه ايه، نمرة واحد. نمرة اتنين، ازاي ياخد ادويته وكيف ان هو يبقى ملتزم بادويته، وامتى يقدر يغير الجرعات في اماكن معينة في ازمنة معينة تحت ظروف معينة. ده بنسميه الاكتف role of the patient in chronic disease management. And this also needs to be discussed and taught by the medical practitioner أو بالhealth care provider، يشرحها للمريض اللي هو الhealth care consumer. This is very important in chronic disease management, and these are the main outlines in chronic disease management. And at the end, again, remember, our aim is to control the pathobiology of the disease and hence to control symptoms. Number two, to prevent the complications and halt or delay the progression of the disease in cases of progressive medical diseases, and to prevent exacerbations in case of intermittent medical conditions, and to have the patient with good quality of life and get control of his or her disease. Thank you so much, Professor Dr. Tarek. أتمنى الصحة للجميع.